I'm really pleased to take a call on this. As everyone knows in the House now, Labor is supporting this bill to Select Committee. We are supporting this bill to Select Committee, but certainly with some concern. And I just want listening to Nikki Wagner's speech, which is pretty much in line with, I think, the speech notes that were given out the other day. Same thing happens. They go to all the members of the caucus. Oh, Nikki made them up herself. Well, wow, Nikki. We really have underestimated you. But in terms... I wouldn't talk about notes from the Maori Party, but in terms of... we have notes here, but I want to say that in terms of Labor, that we are supporting this bill to Select Committee, but the most important thing is to enable the public to have their say. To enable the public to have their say, because there's some pretty sweeping statements going on here and some pretty big promises in terms of what's going to deliver. And if I think we hear, can I say, health savings estimated. Really big health savings estimated. I'm reading that. Whoops, sorry. This is a 1993 statement from the national government. This is their statement then about how they were going to save money and put it into health, etc., etc. Then we hear big savings envisaged in health reforms efficiency. Yep. When? 1993. Not Tony Rowell, but that champion of health reforms, Bill Birch. And what I'm saying to this House is that we actually need to be very careful in terms of when we're going forward, that we do need, and as I said, we support this bill going to Select Committee, but with caution. And what's really important is that the Health Select Committee does enable New Zealanders to have their say, that the Select Committee ensures that all New Zealanders are given ample opportunity. I think this is something that shouldn't be, unlike many things that happen in terms of the government, rushed through. This is something that should be, that the process should be very prolonged to enable Kiwis to have their say and what their expectations are in terms of health reforms. I heard the Maori Party talking about whanaora, that certainly the principle in terms of the principles of whanaora are very, very certainly something that we in Labor don't disagree with, something that we haven't actually heard the National Party agreeing with in the past. It's usually been race-based funding, but on this occasion they're on side with the Maori Party, and that's what happens with a government that works together with their coalition partners. But that's fine. We have got no problems if this delivers for Māori, but what we are saying is let's make sure that the funding doesn't come from other well-meaning organisations that are delivering very, very good health care. And I will say to the government and to the Maori Party that we are keeping a very watchful eye on that. But in terms of... Pardon? I didn't hear that. Sorry? You're terrified. I know you've got such a cosy relationship there. It's really good. I just hope it delivers, because there's been some very big promises made at the cost of tremendous stuff. Because where do I hear the Maori Party making noises and protesting about the health cuts for elderly people, whether they're Maori, whether they're Pākehā, whether they're Indian? Where do I hear the Maori Party talking about those health cuts that we're seeing throughout the country? But the Minister's got a bit to say, and I will ask, because I'm talking to this debate with my disability hat on. And what I'm saying quite clearly is that in terms of this bill, it is about public health and disability, and that is what the principles of this bill is about. And we've heard a lot about how DHBs are going to work much more efficiently and things are going to be much better, and we're going to have so much more, hang on, where is it? So many more savings, big savings envisaged, and health reforms efficiently. Oh, sorry, that's 1993. Health cuts, savings estimated. Sorry, that's 1993. Oh, here we are. the 1990s. Here we have the diagram which says it all, the scalpel, all the people around the operating table and looking for the scalpel, the clamps, but at the end of the day, it's the calculator. And that's something that we on this side of the House have real concerns about, because we support efficiencies in systems. And in fact, we've made a lot in government. We work very hard to get efficiencies, but not at the cost of care. And what we are seeing very clearly under this government, I notice the Maori Party haven't got much to say on this, is some real areas of cuts. Where's the Minister of Disabilities talking? Where's she advocating for the cuts that we've seen to disability services in this country under the national government? Name one. Name one. Name in terms of children in schools, in terms of support for people living at home with disabilities, in terms of our elder people living at home with disabilities, the cuts across the board. And if that minister is sitting in the House saying, I don't know what you're talking about, clearly that minister has to just get off the whānau ora bandwagon and listen to other things that are happening, because whānau ora is not going to deliver everything for all New Zealanders. What we need to look at is a health system that delivers for all New Zealanders, whether it's in the hospital system, whether it's in primary health care, whether it's people with disabilities, whether it's in maternity services, whether it's in support for our young children, all of those things. And I'm telling you, I'm not telling you, Mr. Speaker, I'm telling members in this House that that doesn't happen when money is pulled out of the health system. And so, Mr. Speaker, getting back to the bill, which I know if I don't get back to it with that little small interlude away from the bill, that on this side of the House we are supporting it, but we are looking forward to this select committee process, which many in terms of whether we have in New Zealand or members of Parliament visiting from other countries, our select committee process is second to none. It's second to none because there is another level of scrutiny that actually takes it away from what the government says, this is the one true way, this is the way what we're going to do, we are going to get big savings in health reforms efficiency, and it actually takes it back to the grassroots. And it means that people can come to the select committee, the health select committee, whether they are providers, whether they are clients, whether they are people with disabilities, whether they are young people. Thank you very much. Peace to you too, Mr. Speaker. I would say that those things, Mr. Speaker, are really, really important. And I know that the Health Select Committee is going to have a very big task on their hands, because whilst there is planning requirements, some real efficiencies around DHBs working together, which indeed, Mr. Speaker, the Labour government did while they were in power, that in terms of procurement, in terms of the best efficient way of purchasing, in terms of service delivery, that anything that enhances that, we in Labour are completely behind. And we will go with the people of New Zealand on that. But what I will say quite clearly to this government, is that they are accountable for what they do. And that in terms of the cuts that have happened, that we have seen all too often, that we have challenged the Minister of Health, who I see hanging his head in shame, exactly, that we have challenged this government on because they are not accountable, they are not fronting up to the cuts that they have made in primary health care, in terms of services for the delivery of services for elderly people, that what we want to see, Mr. Speaker, from the efficiencies of what is proposed under this bill is real money going into real services for real people in New Zealand. And that's why we welcome on this side of the House this bill going to Select Committee, so that the people of New Zealand can front up and they can tell this government about where things are lacking and about why
I regret
those
to advise the
efficiencies
member
have to
that
be
it's
made.
now a piece to her.